Hello parents, my name is Dr. Ravi Shankar Swamy. I'm one of the pediatrician and neonatologist at Manipal Hospital Whitefield.
Hi parents, I am Dr. Shweta. I am also a pediatrician and a neonatologist at Manipal Hospital Whitefield. Dr. Ravi, what do you think, where is obesity at this point in country as a whole and in urban cities as well?
So as you rightly said, 20% of our children are obese, and getting them parents to be on the balanced diet which we talked, that is good. The other important aspect which I also tell parents is that involve kids in cooking. So use them when you are making food so that they will learn what are the ingredients, how to cook for themselves, and what is a healthy food which looks like. So that will always motivate them. And the second thing is exercise. As you rightly said, avoid screen time is one of the best way to motivate children to go do exercise. But any simple exercises like playing any sort of games, it's always helpful. If they don't want to play with other children, then cycling, swimming, running, these are all the easiest things what they can do.
We touched a few points about the important aspects of nutrition. I also want to ask about toddlers and newborns. How about the sleep, which is the biggest concern from the parents, newborn sleep habits, which they always question. How do you feel, how should we guide the parents on that?
So most newborns will sleep almost like 16 to 18 hours in 24 hours in different aspects, and if they are very well fed, then every 3 to 4 hours they wake up and feed, and so this is what most healthy newborns will do. And if the babies will have some condition called as infantile colic, and that may be the reason why they keep waking up. I always tell people that make sure you feed them well. If there is sufficient breast milk, then that is good. If there is insufficient for some reason, speak to a lactation consultant who will help you to augment the breastfeeding. And worst come worst, we can't do anything, then supplementary feeds is our always second option. And second thing here is that after baby is fed well, still the baby is crying, then we need to make sure that baby is clean, the diapers are changed, and then if it is still recurrent to infantile colic, then see a pediatrician who will be able to guide you as per the necessity. Do you use any white noises, or do you do anything for the babies to make them sleep?
Important aspect is I always tell parents to have a sleep habit pattern, fixed time habit, sleeping time together, dimming the lights. The environment should be calm and composed so that there is an undisturbed environment around, which also makes them habitual for a particular sleep pattern. And along with that, for babies, some apps are available like white noise app. So it helps a lot, and parents have given a very good feedback about it, that it helps a lot for the babies who are continuously cranky overnight or sleeping. They can be aided, but definitely we need to make child groom for a typical sleep pattern, which can be the most helpful thing for them. That's what I feel.
So the parents, hopefully the discussion was very helpful for you, but what we wanted to summarize is that breastfeeding is the key, because with breastfeeding the taste of the milk changes every time, so the baby gets exposed to newer taste, and as a result they will be open to eat different food as they grow in the later life. So watch out for some more podcasts. Just remember exercises and home cooked meals, avoid junk, and that should be helpful to reduce the obesity. Thank you very much.
Thank you so much.